the lumbar plexus arising from the ventral primary rami of L1 to L4, extending its influence into the sacral region. The femoral nerve takes center stage, directing its signals to the anterior thigh, quadriceps group, Sartorius, and Iliopsoas muscles. Meanwhile, the obturator nerve journeys to the medial thigh, commandeering the adductor group with precision. Let's talk about the sacral plexus, which navigates the lower rim of the extremities. Emerging from the ventral primary rami of L4 to S4, the sacral plexus commands a vast territory. The superior gluteal nerve maneuvers through the greater sciatic notch, enlisting the gluteus medius, gluteus minimus, and the tensor fascia lata. Then we have the inferior gluteal nerve. Marching through the same sciatic notch, it recruits the mighty gluteus maximus. The sciatic nerve takes the spotlight, piercing through the greater sciatic notch and branching into two distinct paths. We have the median branch, known as the tibial nerve. This is going to run down the posterior thigh, posterior leg, and the plantar aspect of the foot. On the lateral front, the lateral branch, or the common fibular nerve. These are the two branches of the sciatic nerve. The common fibular nerve is going to split into two siblings. The deep fibular nerve, which ventures into the anterior compartment of the leg, and the superficial fibular nerve, exploring the lateral compartment of the leg, both converging on the dorsum of the foot. And there you have it, a journey through the intricate pathways of the lumbar and sacral plexus. Let's put our knowledge to the test and reinforce our understanding of these complex nerve networks. Let's dive in. Here we go. So, what are the components of the lumbar plexus? What are the components of the lumbar plexus? That's right. The lumbar plexus is formed by the ventral rami nerves. The ventral primary rami of L1 to L4. Let's go to our next question. Good. Which nerves originate from the lumbar plexus and where do they innervate? Well, let's take a look at this. Here's our lumbar plexus. Nerves do we have coming from the lumbar? The femoral nerve originates from the lumbar plexus and innervates the anterior thigh, quadriceps group, Sartorius, and the Iliopsoas muscles. We also have the obturator nerve, also arises from the lumbar plexus and innervates the medial thigh, specifically the adductor group. Good. What nerves contribute to the sacral plexus? What nerves contribute to the sacral plexus? That's right. The sacral plexus is formed by the ventral primary rami of L4 to S4. Describe the pathways of the superior gluteal nerve and the inferior gluteal nerve. Well, the superior gluteal nerve passes through the greater sciatic notch to innervate the gluteus medius, gluteus minimus, and the tensor fascia lata. Now, our next one, the inferior gluteal nerve, also passes through the greater sciatic notch, and it's going to innervate the gluteus maximus muscle. What are the divisions of the sciatic nerve and where do they innervate? Well, let's take a look at this. Here's our sciatic nerve. And if we travel all the way down the leg and the back of the thigh, we can see that our sciatic nerve is going to divide into the tibial nerve and the common fibular nerve. The tibial nerve innervates the posterior thigh, posterior leg, and the plantar aspect of the foot. The common fibular nerve splits into the deep fibular nerve and the superficial fibular nerve. The deep fibular nerve innervates the anterior compartment of the leg, and the superficial fibular nerve innervates the lateral compartment of the leg and the dorsum of the foot. All right. Excellent work, everybody. Let's keep up the great work.